A very good evening, one and all. I am Dr. Edmund Fernandez, and today I'm going to talk to you about the role of physiotherapists in the process of rehabilitation and health systems. I'm not going to walk you through classical textbook learning. I presume all of you all understand English and you could read the textbooks yourself. But what I want you to understand is what are the critical layers of responsibility that a physiotherapist entails in aiding and strengthening health systems. Many a times we see where a lot of physiotherapists have standard complaints in life. There is a lack of counsel and its regulations. The job sector is underpaid. At times, the job sector is oversaturated. Concentration in metro cities of physiotherapists is large. Competition is prominent. But have you tried to look at the other way around? Instead of looking at the problems, have you tried to look at solutions? As per the World Health Organization report on disability, over 1 billion people are disabled globally, which is basically 15% of the population. Most of these people are concentrated in lower and middle income countries. India also has a dual burden of disease. On one side, pediatric challenges are growing, infectious diseases and non-communicable diseases are rising. On the other hand, our aging population is increasing. By 2050, it's estimated that India's aging population would be about 20%. Presumably, you guys would be senior physiotherapists that time treating people. Have you for a moment thought of how can you convert these problems into opportunities? How can you try to look at making physiotherapy one of those desiring to be professions, one of those called for processes in the health system around hospitals which can strengthen the patient? Many a times, people take life for granted. It's only when somebody is affected by a stroke, if there's hemiplegia, if there's some disability, if there is some pain, that's when we start to think of a physiotherapist. What does this boil down to? The art and practice of physiotherapy gives you the power of healing lives. It gives you the authority of possessing magic in your hands. Imagine a scenario where a patient who's been doing fairly well for last 50 to 60 years of his or her life then starts to have reduced mobility because of osteoarthritis problems, because of age-induced issues. Who are they supposed to turn to? You can go to a clinician who gives you medicines. You can try different forms of alternative medicines, be it Ayurveda, be it homeopathy, be it Unani, Siddhi, or anything. But somebody for the last 50 to 60 years of their life who's been running around, moving, healthy, playful, cheerful, now has to gracefully accept aging because of bodily changes. Who do they turn to? They finally and eventually turn to a physiotherapist who could probably look at reducing their pain, who could probably give them alternative ways of restored mobility, who have in their hands the power to give back those luxuries of life, which otherwise would be of the bygone years. Likewise, imagine a scenario where you have a patient who just suffers from stroke, probably a hemiplegia. You are their only beacon of hope for coming back to life, to appreciating life, and to live life for the rest of the years in how they used to actually live life. But for that, to be able to practice the art of effective physiotherapy management, there are certain skill sets which you, as a person, as a professional, will have to evolve. In my personal observations, comparing physiotherapists in India and also seeing physiotherapists in different parts of the world, I find a huge gap in how physiotherapists operate in the country. There is a lack of communication skills among physiotherapists. You don't communicate effectively. You don't want to get updated in terms of research and advances. You don't want to be part of a therapeutic alliance with clinicians and also with patients. Finally, the patient physiotherapy relationship boils down to quality, communication skills, reassurances, cognitive, psychological, and overall well being. There are not many physiotherapists, both at a junior level and also at a senior level, who have the ability to really instill that belief set in patients, to reassure those patients. Many a times I find physiotherapists often grumbling about pay scales. If pay scales is really a problem, set up an independent physiotherapy unit and make it world class. I've seen a lot of physiotherapy centers around the world who are minting money every hour. So much so that in a day, they just give 8 appointments to people, and that waiting list itself goes on for 2 months. 8 appointments with 1 hour each, probably charging around, say, 500 US dollars per hour. That's the power of physiotherapy. And given today's environment where people do not have time, sit in front of their mobiles and laptops, have stressful work, don't have time for exercises, if there is access to effective physiotherapists in every area of the country, the potential for transformational change, not just for people and patients, but also for processes in health system, is skydiving. Imagine a physiotherapist's ability, if done well, can reduce pain, can possibly avoid a surgery, can aid in faster recovery from cerebrovascular and cardiovascular diseases, can improve vascularity among patients, enhance mobility, prevent a fall, and also make better for old age. The way an outlook of a physiotherapist must change in multiple ways. The therapeutic alliance you have with doctors in hospitals, with patients in wards, and also with your private practice or with communities and societies, holds absolutely critical for people to understand the role, needs, and rehabilitation systems that a physiotherapist can deliver. What today's senior physiotherapists in the market have done have reduced the field of physiotherapy to massage. This is not what physiotherapy is. But the way people have conducted themselves, the way they have carried themselves, the lack of awareness that they have pushed into the system and in societies is reducing the role of a physiotherapist to somebody who provides services in massaging different parts of the body, which is probably affected. How do you change that? You change that by being the change you want to see in the world. That's where the role of physiotherapist assumes prominence. Firstly, you need to revisit your own approach in the hospital, among patients, revisit your own interactions. And mind you, in this process, indulging in health promotion is extremely critical. As much as determinants of health become a policy option for public health, that's equally how determinants of health influence approaches to physiotherapy. Whether it's social determinants of health, whether it's commercial determinants of health, whether it's environmental determinants of health. I'll break this down into 3 layers for you. The social fabric and mindset of a society on when to approach a physiotherapist must change. The environment in which people operate, how they engage themselves, how they conduct themselves, must be guided by decisions made by physiotherapists and also at times by their own clinical physicians. And then, how much does someone pay and for what services is equally important. Now, take for example, if anybody goes to a medical college teaching hospital where training physiotherapists are there, senior doctors rarely come in. That's the first point of entry where the patient loses faith in physiotherapists. Juniors come in who don't communicate well. Many a times I have seen in my own this thing where colleagues dress up very shabbily, they wear slippers and come to see a patient. And these are, mind you, factors that really influence the mindset of a patient. When we did medicine, we were taught that if you can't think like a doctor, at least act like a doctor. And this is essentially the same kind of roles which physiotherapists in training must start to imbibe, learn, and practice. Dress up smartly, look smart, look presentable, interact with the patient with empathy and in-depth communication, and then try to see what is it that the patient is trying to say, whether it's a problem that emerges out of the home, it's a problem that is a workplace problem, it's a problem in how the patient's lifestyle has evolved. You will find answers, provided you are willing to seek for answers. In my more than a decade of practice and experience, I've rarely come across physiotherapists in India who are very vocal about what work they do, who are very passionate about what they want to do, and who are really trying to influence the kind of change they want to see in the world. Imagine countries where people make, say, $500 per hour just by indulging in rehabilitation services. What opportunity would you have in a country like ours, where we have 1.4 billion people? The opportunity is huge. The potential to shape lives is huge, provided you're willing to look at the patient from a holistic perspective, wherein you can provide psychosocial well-being with physical well-being. That's where you need to go. That's the level of trust and faith you need to reach into. This is when you will have health systems accepting and mainstreaming physiotherapy. This is when you will start to understand why patients are demanding physiotherapy. This is when you will start to educate doctors, nurses, other allied colleagues on the importance of physiotherapy. Not everything can be achieved by medicines. Far lesser things can even be achieved by surgery. Nature does 99% of the work, and we as medical service providers must acknowledge that fact. But the roles you can do in just aligning the body system and bringing that back into original forms is transformational and magical. Question: are you willing to do that? Are you really wanting to do physiotherapy to just build a career because your parents said something, take up the profession? Or are you looking at building a life for yourself, for health systems and hospitals around where you practice, and importantly, for the world? This is a decision of conscience. This is a decision of commitment, which you give not to the patient, but to yourself. When I mean health systems, I'm not talking about a physiotherapist merely working in a high-profile hospital. No, that's not how health systems work. You need to cater to and customize the role of a physiotherapist at the primary healthcare level. You need to look at the role of a physiotherapist at a secondary healthcare level. You need to look at the role of a physiotherapist at the community level. You need to look at the role of a physiotherapist in door-to-door rehabilitation processes. You need to look at the role of a physiotherapist from a perspective of appreciating luxuries of life, to then bringing back those very luxuries that really matter to human beings and which is importantly critical for human well-being. That's where you need to get at. Another area of concentration you need to look at is assistive technology. With healthcare going through a wave of transformation through assistive technology, through artificial intelligence, and also health tech, what is the kind of role that physiotherapists can play in enhancing the fields of cardiovascular diseases, cerebrovascular diseases, lifestyle diseases, pain management, geriatric issues, pediatric issues, kidney and other dimensional organ-based issues, and largely issues which clinicians feel is not an issue. That's also the blind side where physiotherapists must get to. I can't do for you what you need to do for yourself. Anybody who understands language can pick up textbooks, mug up those paragraphs, write their exams, pass the exams, move on, probably get a job. But deep down in your heart, ask yourself, are you living to make a difference? Or are you existing because you need to exist? You will find your answers. If not now, later. And I'm always around if anybody would like to seek guidance and assistance on what can be done differently. Prakara's team has all my details and happy to be of support. And now if there are any questions, which probably you might have in mind or you want to ask, happy to take questions as well. Shahnaz, are there any questions?
Nothing, sir. All good.
Yeah, so if there are no questions, then I think we can wind up and look forward to more interactions in coming times.
Yes, sir. Thank you. Thank you
All
so
right.
much.